sponsorship program as a whole, you know, since probably the end of last year, and really started involving the Division of Insurance and Medicaid staff at the beginning of the year. So I do agree. I think that there could have been better collaboration, you know, maybe having like advisory committees or meetings with certain members of the staff. But we have formally written up, we put a lot of blood, sweat, and tears into the reports for the board meetings. And I think that because our board meetings tend to be so long, we just kind of glossed over those sections. We didn't actually read the reports. The board just voted on, you know, the steps that we needed to take to start implementing the tribal sponsorship program. So, and the tribes themselves have been very, very adamant on the timing of implementing this. They've been wanting to do this.
Ms. Davis,
Yes.
I'm very sorry for interrupting. Given that this is not an agendized topic, I know it came up during the interviews, but because it's not agendized, I would only go so far as the discussion in these regards and on this matter.
Yeah, that's fine. I understand.
I apologize.
Okay. You're on mute, Dr. Jameson.
Janelle, thank you for providing us with the staff feedback that was available. Just wanted to go ahead now. I think we're in an excellent place to see if any of our board members would like to make further comments and have further discussion, or if they were ready with the additional information provided to proceed for vote. Any hands up from the board members? Tiffany, do you see any hands up from board members that would want further comments, discussions?
Dr. Jameson, Madam Chair, Tiffany Davis for the record, I do not see any hands up at this time.
Okay, so let's go to the next question, which was the next issue, which was, are you comfortable where we start off with each board member? We were naming the candidate they would like to vote for as if it was a primary and there were 3 names there. And then we tally up who gets the most votes. And if they're split, we will take the 2 with the most votes and we have a runoff. Or does anybody like to recommend another way to do this? Any hands up?
Dr. Friedman, go ahead.
I have Sarah Friedman for the record. So just to make sure I understand the procedure, are we saying that they have to be a tie in order to have further discussion, or is it that we will go ahead with extra discussion for the top 2 candidates?
We can absolutely do that as well. If there's no further discussion at this point, we can go ahead and take a vote. And then if there is a tie, we can have further discussion if it's the option of the board, or go on with a final vote. But we can absolutely offer that as an option.
Sarah Friedman for the record. I think I'm just thinking I would be comfortable going ahead with a vote if we have the opportunity to think a little bit more about the top 2 candidates rather than say whoever gets the majority or whoever gets the highest number, we would go ahead with, if that makes sense.
It does make sense. So we could take the top 2 and then open for discussion of the top 2. And if there is discussion, you know, if there are people such as yourself who want to further discussion at that point. Otherwise, if nobody does want to discuss, go to the final vote. Okay,
Madam Chair, Valerie Clark, I would agree with that. I think I would want to hear some of the other board members' perspectives before I gave my final. So if we could discuss the top 2, that would give us time to discuss those top 2 people, I think.
Oh, excellent. So if that is good, If anybody else has another comment, we'll wait a minute for you to raise your hands. Otherwise, we'll proceed with this plan, which means that Tiffany will ask each board member to name their candidate. And that will get us through round one. And then with the top two, we will proceed with the discussion after the top two have been selected. I don't see any hands up. Tiffany, do you see any hands up before proceeding with that process?
Madam Chair, Tiffany Davis for the record. I do not see any hands at this time.
Tiffany, would you take roll call and I will go last, and we will have everyone go ahead and give their candidate.
Yes, Madam Chair, Tiffany Davis for the record. I'll go ahead and start with Valerie Clark.
Thank you, Tiffany. At this point in time, my top choice would be Russell Cook.
Thank you. And Miss Elsie Levon Lewis.
My top candidate would be Troy Johns.
Thank
I'm
you.
sorry, Russell Cook. I'm sorry, Russell Cook. I'm looking at the wrong name.
No problem. Thank you so much for confirming. Dr. Sarah Freeman.
I would say at this time, I would say Troy Johns.
Thank you. And Jonathan Johnson.
Russell Cook.
And Quincy Branch, who I saw joined us again. Quincy, are you on and able to give a reply? Not hearing. I'll come back to him in just a moment. Dr. Jameson, I'll go ahead and call on you.
Russell Cook.
Okay, and then one more time, I just want to make sure that Quincy has a chance if he is on to reply. Thank you all for your patience while we see if he's available. I know he had to drop off at one point for an emergency, but it looks like he rejoined us. So I just want to, again, verify that he has an opportunity to vote. So thank you for your patience with me while I confirm. Madam Chair, Tiffany Davis for the records. I just wanted to let you all know that I did just text Mr. Branch to see if he is indeed on or if he's away from his computer and unable to vote at this time.
Thank you, Tiffany. I think we're all comfortable giving this a little bit more time.
Madam Chair, at this time, I'd like to ask our DAG if I see a voting member's name, however, he's not responding regarding whether he's actually available or not, how would you like us to proceed?
Mike Denver for the record. Unless I'm mistaken, I believe you still have a quorum, so you can proceed without him. And this isn't the official vote. This is just the preliminary to get to the official vote.
Perfect. Okay, sounds good. Then, Madam Chair, that concludes, and Jose Melendez is not joining us, so that concludes our, yes, the board's decision at this time. Again, as our DAG has said, not the final vote, just preliminary.
And could you read us the total now?
Yeah, the total is that Jennifer Krupp received 0 votes, Troy Johns received 1 vote, and Russell Cook received 4 votes.
Thank you, Tiffany. We'll proceed to our discussion of our top two candidates, Troy John and Russell Cook. And at this time, I will look for hands for those who would like to give additional comments, questions, discussion. And counting on your eyes, Tiffany.
Yes, Madam Chair, I see Dr. Freeman has a question or a comment she'd like to make.
Dr. Friedman?
Yeah, thank you. Sarah Freeman for the record. I think that we heard two excellent interviews. Both these candidates gave excellent interviews, and I really enjoyed hearing about their expertise and ideas for the exchange, and hearing about how they would lead the exchange in various ways. And I'm sort of torn, to be frank, about my vote. And one thing that was particularly that is particularly compelling to me about Troy Johns is bringing in an outsider perspective. That said, given what we've heard about the current needs of the exchange, I also do recognize that could be more challenging bringing in someone from the outside, at least in the short term, because it does sound like someone is needed who can step into two people's roles immediately, for it, again, in the short term. And that makes it particularly challenging for me to know that that's the right choice, that that's the right thing to base the decision on. I really was interested to hear about Troy John's sort of entrepreneurial perspective and ideas about what that could bring to the exchange. But I think I'd be curious to hear what other board members think about that, and how that could potentially be an advantage that would that would be something we should prioritize over someone with institutional knowledge and who could clearly take on all of the key roles of the executive director. So I'm just curious about how people think the sort of entrepreneurial background of Troy Johns could be an asset that would help the exchange.
Do we have any board members who would like to make comments?
Madam Chair, Valerie Clark has her hand raised.
Valerie, thank you.
Thanks, Madam Chair. I echo that statement. I almost to the T. I see a great value in maybe bringing in someone who has some entrepreneurial ideas and some fresh experience, or different experience, who's coming in from the outside. I think there's some real value there, but I'm concerned about the ability for him to jump in and just take over something that is kind of like a fast moving train right now, especially with the shorts, but then, with the exchange being short staffed and what have you. So I completely echo Sarah's statements. And ultimately that is why I chose Russell as my first choice, but could easily be swayed to Troy if I thought in a different time. You know what I'm saying? So those are my comments.
Madam Chair, Ms. Lewis has her hand up.
Levon Lewis, please.
Yes, I agree with Ms. Clark. I feel that our immediate needs for an executive director, while I support the entrepreneurial aspects of our operation, and I have been on the board when we have had other executive directors from the outside that have not been as successful as we would have hoped. But I do feel that our immediate needs for the immediate future say that I would have to support Mr. Cook for the position because of his knowledge of the operation coming in.
Thank you. And were there any other comments?
Jonathan Johnson. So I agree with everything that's been shared up to this point. I'll just kind of point out, this is more of a comment than like a question. This is the second time that we've interviewed Troy Johns. For those that were around when Ryan High was offered the job last time, Troy had interviewed, and he was impressive last go around as well. I was excited to see him throw his hat back in the ring again this time. I think the last few executive directors have come from internal candidates, and a lot of the same arguments that we've shared in the past have been shared again today. Just kind of what that experience and familiarity with that process looks like. And that's, I think I'm with everybody else where I'm a little bit torn in that regard. Valuing the experience and familiarity with the agency, being able to hit the ground running. But I also appreciated the comments by Commissioner Kipper and Stacy, just kind of with a different perspective than maybe we would look at things as a board. So it's that's how I had them ranked, as I kind of I ranked them as we've been talking before we got to a vote, but it's pretty close for me.
Thank you so much. I just appreciate everybody's comments. And as the chair, I always like to reserve any comments unless, to be like break a tie or something to say. But I just would say I would echo everybody's comments. We have two outstanding candidates here. And yes, sometimes you also have to look at the situation we're in and take that into account. And so I am ready to hear the vote. And
Dr. Jameson, can I just ask a really quick question for my own?
Sure.
Sorry, I don't know
Yes.
this again because I had to miss so much during session.
Yes.
How long was this position posted for again? Do we know, Tiffany, maybe you know?
Yes, Tiffany, and can tell us exactly how long that was posted for?
I know it's
Yeah,
a while.
just give me one minute, Tiffany Davis, for the record, if you don't mind. And go back here.
Did we not extend that as well, because we had initially limited applicants and we extended it, I believe.
The position for recruitment was posted on May 17th, 2023, and the posting closed on June 9th of 2023. And we received 10 applicants in total.
Did we have any applicants come in afterwards?
Not after the closing date. No, we did have one of the applicants have to drop. So we were down to 9 applicants. And then when the board at the June 22nd board meeting voted for the 4 that would move forward in the interview process, then that one of those 4 needed to drop for personal reasons as well. So then we were down to the 3 that the board has been interviewing today.
Did you have any other questions regarding the application posting process?
No, thank you. I just, trying to understand urgency, but also just mindful of the importance of the role. So I just was curious how long we had waited. I know it's hard to find candidates for Nevada.
Thank you very much. All right, then. I think we unless I'll give it another little minute here, if any other comments, otherwise I think we can have Tiffany go ahead and take a roll call vote. And this would be, of course, our final vote for selection of our CEO of the exchange.
And Madam Chair, if you don't mind, if I clarify with our DAG real quick, Mike, will we do a final vote and then do a motion, or should a motion be done and then with a final vote? Just so we get the order.
It'll be up to the board's discretion, but I would, as long as the actual final formal vote goes, follows the standard process of motion, second.
Yes, I would say we'll go ahead with the vote, and then once we have the candidate's name, we'll make a motion.
Sounds good. Thank you, Madam Chair. Tiffany Davis again for the record. So I'll go ahead and go through the roll call again. So Ms. Valerie Clark.
I vote for Russell Cook.
And Ms. Lewis.
Vote for Russell Cook.
And Dr. Freeman.
I vote for Russell Cook.
And Johnson Johnson.
Russell Cook.
And I'm just, again, just to make sure if Quincy Branch is on, I just want to make sure he has enough availability. I don't think he's with us, even though his name shows. Okay, not hearing from him. Then Dr. Jameson.
Russell Cook.
Okay, Dr. Jameson, Russell Cook has received five votes from our voting members.
Thank you. I would love to entertain a motion for Russell Cook to be the new Executive Director of the Silver State Health Exchange.
Valerie
Johnson
Clark.
Johnson.
So go. Second.
First and second with
Yep.
Jonathan Johnson, Valerie Clark, thank you. And everybody, we'll just go ahead and do one more roll call vote for this. Tiffany?
Sounds good. Ms. Clark.
Aye. I wasn't sure what I was supposed to say.
Oh, yay, nay, yay.
Yay. Okay. And Ms. Clark, I believe that was a yay, correct?
Yeah, yes.
Thank you for confirming. Ms. Lewis.
Aye.
Aye. Thank you so much for confirming. Dr. Freeman.
Aye.
Jonathan Johnson.
Aye.
And again, I believe we do not have Quincy Branch with us. And then Dr. Jameson.
Aye. Okay, we have 5, and everyone has supported the motion. So the motion for Russell Cook as the new CEO of the Silver State Exchange has passed. Oh, did we do? Yeah, we did the second discussion, and it's passed. We're good. Excellent. Congratulations are in order for Russell Cook.
So Madam Chair, and I believe our HR representative Monique or our DAG can correct me if I'm wrong, but if that this time, then since the board has made that vote, we would bring Russell Cook into the main room for you to make that official offer to him and for him to accept. So can Monique come on and confirm that I'm correct on that?
Yeah, that is my understanding. Yes, correct. You can bring him in and make the offer.
Thank you so much, Monique, for confirming that. And Caitlin, do you want to go ahead and move Russell Cook back into the main room?
Do we need to include what his salary would be?
Not at
No.
this time, Dr. Jameson.
Thank you.
And Dr. Jameson, Madam Chair, Russell Cook is in the room with us.
And we'll wait for our camera on Russell.
His camera is on, Madam Chair.
Welcome, Russell. Although I can't see you, but yes, Florence Jameson Chair, we are delighted to tell you that we have just finished our vote and that you have been unanimously approved new CEO of the Silver State Exchange. Congratulations. And again, thank you so much for your dedication, your unbelievable hard work, all the expertise that you will bring to this job, including the incredible ethics of your honesty, integrity, and transparency. And I do believe that you will also bring a lot of innovative entrepreneurial type ideas, even though you've been well entrenched in the current system. And I'm just excited to offer you this position. And what say you?
This is a tremendous honor. I moved more than I thought I would be, and I wholeheartedly accept. I'm really looking forward to serving this board. Thank you so much.
I would love for the board to have an opportunity to say something as well, the other members.
Thank you.
I'd just like to say congratulations, Russell. I look forward to working with you. And if there's any assistance I can provide at any time, I'm always available.
Thank you, Ms. Clark. I'm very grateful.
And anyone else, please feel free to say your name and speak up. Our ex officio members with their wonderful input today. Please, if anybody else would like to make any other comments, please feel free to do so.
Congratulations, Russell.
Oh, thank you,
And
Ms.
good
Clark.
luck.
Thank you very much.
Congratulations. It was great to hear about your expertise and can't wait for to work with you.
Thank you so much. I really appreciate your time and consideration today.
Jonathan Johnson, just want to say congratulations. Really appreciate the energy and enthusiasm that you shared during your interview, and look forward to working with you.
Thank you. It's an honor. Thank you.
Echo that. This is Stacy Weeks for the record. I'm looking forward to partnering with you at Medicaid. We have a lot of work ahead of us. Thank you.
Absolutely. Thank you so
Congrats.
much. You'll be hearing from me very soon. Your points.
Well, I hope so. Yes, thank you. Look forward to working with you.
And
You as well.
from the Division of Insurance, Scott Kipper, for the record, I would echo Director Weeks. We're looking very much forward to working with you and the Crack Exchange team.
Thank you, Mr. Kipper. And likewise, your points were very well taken. I'll be in touch very soon. I would very much like to share an overview of what we've been working on for our tribes and see what recommendations you might have.
Thank you, everybody. And thank you to the staff for all their hard work in posting this and reviewing all the applications, organizing it, and for our DAG and everyone who has been involved in making sure this process was transparent, ethical, with integrity, transparency. And I just appreciate everyone that is volunteering here for the entire day that you've been spending. So we will, I'm not sure, but excuse you, Russell Cook, and go with our last couple of items on our agenda so that everybody can be footloose, fancy free. It's been a wonderful effort put out by all, and I can't say how happy we all are with the result. Thank you, Russell Cook, for this.
Madam Chair, can I ask one question? Did we establish a start date for Russell?
Oh, yes, he's starting tomorrow. Well, as he said, as soon as Human Resources can take care of the paperwork.
Madam Chair, and I'd like to answer Ms. Clark's question to that, and for the board, so that you know, all the offer letter and the paperwork that comes after this, myself, I'll be working closely with HR regarding all of terms, conditions, paperwork that needs to go into getting him into his new position. So if anybody has questions about that, please let me know.
Thank you. Okay, is Russell out now or in, or probably doesn't matter?
Actually, at this point, Dr. Jameson, it does not matter since the interview process has concluded. The candidates may join our meeting. I will say that Janelle Davis has been tasked with calling the other two candidates who have not received this position to kindly and politely let them know that they were not chosen at this time for this position. So Janelle Davis will make those phone calls here shortly.
Thank you. Item number 6 for possible action is for action. Review the comments, feedback from the insurance carriers collected during the public comment period approved. at the June 22nd board meeting related to the proposed additional language in the exchange, annual issuer agreement and the Nevada Health Link policy manual, and approve of the final language in reference to the CFR 155.240B and aggregated billing between issuers and Nevada tribal nations. What I would like to do at this time is ask for a motion and a second, and then have discussion prior to our vote, and hopefully have our input from everyone, especially our ex officio members on this action item. Do I hear a motion?
This is Elsie Lewis, and I move that we approve the aggregated language for the tribal program.
Thank you. As is there a second? I think, did we get our second?
Sarah Friedman for the record, I second.
Thank you, Dr. Friedman. I would like now to open for discussion and comments.
Dr. Jamison, Tiffany Davis, if I may, on this agenda item, there's a lot that is entailed with the approval of this. So I just wanted, if with the board's permission, if you don't mind, if Janelle Davis or even Russell Cook provide a little bit more, maybe information as far as what the board is approving here, just so it's very, very clear what's kind of going on in this process. Would that be okay?
Oh, this is the perfect time for that discussion. It would be fantastic. Thank you so much.
Great. Janelle, do you want to go ahead and jump in?
Yeah, absolutely. Thank you so much. And now is a more appropriate time to discuss this than when I was giving feedback. So my apologies again for that. And I do want to note that in the previous two board meetings, we have written up formal reports specifically as it relates to the tribal sponsorship program. And both of those reports were also voted on, but we didn't have the opportunity to actually read the full report. The board just voted on what they needed to vote on, which is fine. It's to your discretion, but it is obviously a hot topic item for everyone. And so I was hoping that I could at least read the summary of kind of what's going on currently with the project itself. So ironically enough, we did remove the background information, but all of this information is on our website from past board meetings. So just in the interest of time, I won't, give the full background, but this agenda item specifically is about the aggregated billing for tribal health clinics after the conclusion of the public comment period, which was actually extended based on our last board meeting, since this meeting was not when we were planning on having it. So I'll just read over this, the summary of changes. So the exchange received a good amount of comments and questions during that public comment period. This feedback has been included in the for board consideration and approval section of this report. The changes reflected below are in the proposed language for the Plan Year 24 Issuer Agreement, as well as the Nevada Health Link Policy Manual, and they were intended to address and resolve these comments and questions and feedback. In particular, the feedback we received convinced the exchange that an additional document, which was not included for review during the public comment period, would be necessary to cement the business relationship between the tribal health clinics, the participating issuers of their choice, and clearly delineate the roles and responsibilities for both clinics and the participating issuers. No, I'm sorry, I'm misreading here. Clearly delineate the roles and responsibilities for both parties. Sorry about that. So this forthcoming document that I mentioned, which we are referring to as the addendum for the aggregation of monthly premiums for tribal enrollees, is still under internal development. However, a draft version of this document will be circulated to both the issuers and the tribal health clinics sometime in August for their review by their respective legal teams. So we do have within this report the existing CFR and then the proposed language that we are adding to the draft issuer agreement, as well as the Nevada Health Link policy manual. So I'm not going to read all of that, word for word. And then what you just voted on and for the board consideration and approval was to basically consider the final language based on the feedback that we received from issuers. So also included in this document or this report are all of the questions that we received from the insurance carriers and other stakeholders during the public comment period. So we have all of these questions listed out. This was kind of in lieu of public comment, if you will. All of these questions have been answered and will be posted on our tribal webpage on nevadahealthlink.com. There was also a letter from Anthem, which is now referred to or called Elevance Health. I believe I'm pronouncing that correctly. But this letter or memo was specifically addressed to the board, which is why we included it here for you. And then the other questions received from insurance carriers and also our new carriers that will be coming onto the exchange were listed here. And these were just by way of email. So again, all of these questions have been answered and we will be posting all of this on our website. So any further questions after that review?
Caitlin Blagan for the record. It looks like Russell Cook has his hand raised.
Thank you, Caitlin. I just wanted to kind of add to what Janelle read and clarify in light of some of the questions that were raised by earlier by Ms. Weeks and by Mr. Kipper. There are a number of documents that are referenced in this proposal here. And with regard to what exactly the board is voting to approve today, there are two key documents. One is called the Nevada Health Link Policy Manual. That is a public-facing document that describes Nevada Health Link policies applicable to all of our stakeholders, including consumers, enrollment partners, insurance carriers, health providers as well. That document is the main part of the reason, it's my understanding, that we opened up this public comment process. That was in large part due to the recommendation of our DAG. There's a second document, which is called the Annual Issuer Agreement. And I just wanted to clarify that document has an annual review process associated with it already. It usually is circulated amongst our insurance carriers each year in August for their commentary and review. And I just wanted to clarify that document, the issuer agreement, is not going to be finalized in its existing form based upon the vote today. What we've provided for review and approval is an excerpt from that document. It's one specific subsection of that document, which we have developed language for the aggregation of these monthly premium payments. There will be a second round of review in large part because there are additional changes that are not to do with aggregated billing that the exchange is proposing to take effect in plan year 2024. So with regard to the questions that were raised by Ms. Weeks and by Mr. Kipper, there will be an additional opportunity to refine that language, and we would very much look forward to your support in that department. There will also be an opportunity to review and provide commentary on this additional supplemental document that Janelle mentioned, the addendum covering the aggregation of these monthly premiums. So the addendum is intended to be attached to the network provider agreement, which would be subject to renewal on an annual basis. I just wanted to clarify a little bit about the mechanics of what we were proposing. And yes, Ms. Weeks, I see you have your hand raised.
Thank you so much, Russell. That is extremely helpful and clarifying that you actually have further clarification of the steps forward. Very helpful indeed. Are there any questions? Does anybody have further comment or questions for Russell or in general regarding this motion today?
I have my hand up, Dr. Jamison.
Oh, thank you so much.
Thank
Please.
you. So Russ, thank you. That was super helpful. I appreciate understanding sort of the authorities piece of this and where it goes. I think just because I am a newish board member, I would recommend to this board going forward that there is more of a, and maybe you guys did reach out and during session I was unable to do this, but some sort of prep for new board members, because it's really hard to engage, understand, like, oh, you're basically changing policy, which in my mind as an attorney is sometimes like regulation, but not necessarily. But it's helpful for me to understand these things. And I missed a lot because I was busy during session. Medicaid has its thing too. And I know we're ex officio, but we are board members. And so, having sort of that new member training would be really helpful. And so we can better engage, especially as new board members. But thank you, Russ. I appreciate the explanation. Look forward to continuing to work with you on that.
For my part, I think that's an excellent suggestion. Frankly, I think in hindsight that this process would have benefited from that degree of board involvement. And I think that's definitely a lesson learned here. We are, I wouldn't say that we're making it up as we go along here, but this is definitely new territory. We're chartering new territory for the exchange. And I think the collaborative nature of this process, I think we certainly had some successes, but the collaborative nature has definitely highlighted some deficiencies to the process as well. So we definitely look forward to closing those gaps.
Thank you. No, we all struggle with that. So I will say Nevada Medicaid is not always the best at that either. So I understand how that goes. So please, just know we want to work with you on things where we can. So I just want to echo that offer. So thank you
very much. I appreciate you putting that in constructive terms as well, because we feel the same way. Thank you.
Thank you so much, Stacy. Were there any other comments?
Hello, board. Madam Chair, I'm so sorry if somebody had asked me a question. My apologies. I was just making a few phone calls to the candidates who had not been chosen.
No, you did not miss anything questions for you. I don't see any other hands raised, so I believe we are ready for the final vote. So that being the case, do I, one moment here as I get my computer up to speed here. So I think we are ready now to vote on the proposed additional language in the exchange annual issuer agreement, Nevada Health and Policy Manual, and approval of final language in reference to the CFR 155.240B and aggregated billing between issuers and the Nevada tribal nations. So do I hear a motion and a second? Do I hear a motion? Thank you. Lavon Lewis, a second?
Now, I believe you had a motion to accept this. That was the motion that I made earlier.
Oh, okay, that's right. So we can take our vote. We're done with our discussion. Thank you so much. I'm ready for lunch, low blood sugar. And so we'll go ahead and take a vote. And I think for this, it will just be an aye. Everybody in favor to say aye?
Aye.
Aye.
Aye. Any opposition? None heard. Any abstinence? Anyone abstaining? Hearing no other abstaining, or then it's unanimously passed our motion. Thank you, everyone. And now for our discussion of possible actions regarding dates, times, and agenda items for the future meetings. I would entertain any recommendations for any actions regarding items for future agenda. Tiffany, at this time, can you remind everybody for the date, time of the next meeting?
Yes, Madam Chair, Tiffany Davis for the record. Our next meeting that is scheduled is currently on Thursday, October 12th at 1:30 p.m.
And is there any particular items that any of our members would like put on the agenda? I'm sure we will have follow-up on the action item that we just passed, the progress on everything going on with the Nevada Tribal Nations and the exchange. We'll have an update, I'm sure. And we were also expecting an update as the months and the year goes on, as the public health crisis emergency had ended, the update on how we are doing in helping those that are rolling off Medicaid and how well we are capturing them to give them the assistance they need with a qualified health plan that's appropriate for them. Were there any other particular items that other board members would like to be sure are on the agenda next time? Well, I, for one, will be excited to hear our new chief executive officer's first report. It's always something we all enjoy reading and hearing from you. So we look forward to that report in our next meeting. No other comments or agenda items? I'm trying to think if there was something else that somebody mentioned they wanted to come back on the next meeting.
Public comment.
What was that? Lavon, I didn't catch that.
Oh, I was just saying, are we down to public comment? That was my question.
Okay. Public comment.
Madam Chair, thank you so much, Tiffany Davis for the record. I'll go ahead and ask Alexandria if in the Carson City Conference Room, our physical location, is there any public comment in our physical location?
Alexandria Zanini for the record. There is no public comment here in the Carson City location.
Thank you for that confirmation. And then, Madam Chair, I'd like to go online and like to remind those who are online, if you would like to make a public comment, please raise your electronic hand or indicate in the chat box if you would like to make a comment. And if you could please indicate that, Caitlin will call on you and you may unmute yourself at that time. Caitlin, do we have any public comments online via chat or electronic hands?
Caitlin Blagan for the record. No, Tiffany, I am not seeing any electronic hands at this time.
Okay, thank you. And on the phone lines, if we have anybody on the phone lines, anybody on the phone lines may unmute themselves at this time and go ahead and make public comments. Is there anyone on any phone lines, Caitlin, that you can confirm?
Caitlin Blagan for the record. No, there is nobody on the phone lines at this time.
Thank you for that. And Madam Chair, I would like to say I just got off the phone with our two candidates who were not chosen for the position. And Troy Johnson just expressed his gratitude for the opportunity to speak with you all and for the pleasure of once again being interviewed in front of you all. So I just wanted to add that.
Thank you very much. I will entertain a motion for adjournment and just thank everyone again.
Jonathan Johnson, motion to adjourn.
Motion.
Everyone in favor? Aye.
Aye.
Thank you all and have a wonderful day. Looking forward to seeing you Thursday, October 12th. Thank you so much.
Thank you. Have a great day.